to Shrink Wrap Hawaii. I am your host, Stephen Katz, a marriage and family therapist, and today I have a very, very special guest, Dr. Daniel Lev. Welcome aboard.
Thank you so much. Great to be here.
So, Dr. Lev.
Yes.
A little bit of background. Where do you hail from?
I grew up in LA, did about 20 years there, and when the smog was too much, I moved up to the Bay Area for about 40 years.
And what did you do there?
Oh my goodness. I was a folk musician and went to school. Yeah, I went to school and eventually had the wild and crazy idea to become a clinical psychologist. And so I went to grad school and then practiced and for Kaiser and doing quite a bit up there.
And what brought you to Hawaii?
Everybody asks me that. It's Hawaii. I mean, the people, the place. It just, when I got off the plane the first time, 12 and a half years ago, it was in Maui. As soon as I got off the plane, I felt like I'm in the Holy Land. Literally, it just had this feeling. And so I can't explain much more beyond that, except, everybody here knows you make sacrifices to live here, and I was willing to do that, and that's what brought me.
And what kind of psychology do you do?
A number of things. Of course, we're going to talk a lot about chronic pain psychology, but also do a great deal of hypnosis, helping people with relationships and the usual kinds of things with depression, wanting to change habits or anxiety problems, trauma, all of those kinds of things. Yeah.
So what is chronic pain psychology?
Chronic pain psychology is essentially, as a practitioner, I have been trained in health psychology, how one's health affects their emotional life and how your emotional life affects your health. And it's just amazing how they interact. Maybe 30 years ago, this concept of biopsychosocial medicine, or what we would call mind-body medicine, that the mind and the body work together. And just because you have chronic pain doesn't mean you're crazy. It means you're dealing with a physical condition that affects your mind and through your brain. And chronic pain psychologists are trained in understanding that and using the skills of a therapist, but also some other skills as well, to help the person get more comfortable.
Okay, so I come in to see you because my back has been hurting for a year now, and I've been to I've been to the regular doctors, and they tell me I have this and I have that, and they've given me some pain pills, but nothing really seems to work. What would you do when I show up to your door?
Well, I'm Jewish, so I answer questions with questions. Or actually, let me get to that question.
Yeah.
But first of all, you might not come see me because most people don't know what a chronic pain psychologist is. They don't realize that this is the treatment of choice, working with a physician, maybe a physical therapist, and a chronic pain psychologist.
Right, they wouldn't even know you exist.
They wouldn't know. And what most people in your position would be doing is what I call doctor care only. You're going to practitioners who do things to you to help you feel better. Unfortunately, it's limited. You can only take so many pain pills, so many procedures, so many physical therapy this or acupuncture that, so many things. And there's a point you may come to where you see maybe there's something I can do for myself. And you come to a chronic pain psychologist who's like a coach. And I will show you how to do certain skills to help you feel better, okay? And so this is what I would start with you, is talking to you about how pain works, and then moving into training you in some of the skills, and especially not just training you in the skills, but finding out what are the things in your life that are exacerbating the pain. Because stress often raises the pain level, all right? Did that answer your question?
Somewhat.
Okay, all right.
But I just come in and I say, my back hurts. That's all I know. And not only that, I can't do the things that I used to do.
Right.
I might have to change careers, which is terrifying.
Right. Yep.
And I can't play with my kid the way I used to play with my kid.
Okay.
And
what do you do?
Yeah, what do I do?
Okay. So first, I will completely empathize with your situation and let you know something really important.
Which is?
The pain is real. It's
Hey,
not,
you don't got to tell me
it's
it's
not
real.
in your head.
Yeah.
It's real, okay?
Okay.
Because so many people that come see a psychologist,
Yeah.
and some doctors will talk to you like, oh, it's all in your head. And actually, they're right, it is in your head. It's
Right.
your brain, okay?
Yeah.
It's your nervous system, and our mind is connected to our nervous system. But we have some kind of physical condition causing this. Most of the people I see, like you, coming in, had a fine life.
Yeah.
There was nothing wrong. It was
Yeah.
fine.
Yeah.
Until you had that accident or that disease
Right.
or whatever
I
condition.
got to be 55 years old.
Exactly, or got to be older, exactly. You wake up, oh God.
Yeah.
You know, so this happens. So I will normalize and let you know, I believe you, you're in real pain. Let's figure out what we can do about it. Then I explain, how does pain work? Okay, so here's pain, here's misery. They're not the same thing. Misery is like stress and depression or anxiety or general anger, all kinds of normal things when we're being miserable. Okay?
Yeah.
Now the problem is, if our misery goes up, our pain goes up. And it's not a mental thing. This is the thing people don't understand. When your misery goes up, your nervous system gets hypersensitized.
Uh-huh.
Now, pain itself creates misery. Pain itself will sensitize your nervous system, okay? Now, the cool thing is this. If you can learn how to lower your misery, one of two things happens. Either the pain goes down, or, and this sounds a little unusual, people will come and say, yeah, the pain's the same, but you know, it's not bothering me in the same way.
You know what you made me think of when I did have my back pain?
Yeah.
The only time it didn't, well, it's not that it didn't hurt. When I was having sex, I didn't care.
Well, this is beautiful.
But it's like you're saying, it's not that it hurts less. It's just like I could still get on with the rest of my life.
Exactly. Now, the opposite of misery I call comfort. So when your comfort level goes up, like when you're having a beautiful time making love,
Right.
all right, oh my God, you know,
Right.
it raises your comfort level. Here's an analogy. Let's say I'm sitting in a room, okay, I can't get out, there's a pile of pillows over here, and on the floor over there is this speaker blasting the worst music I ever heard. It's driving me nuts.
Yeah.
I can't break it. Oh, pillows. I see pillows. I pick up a pillow, I drop it on there, it muffles it.
Uh-huh.
That's better. But guess what? It's still screaming under the pillow. I don't know that because it's muffled it. I throw 2 more pillows, it's even better. Still screaming under the pillow. 10 pillows, it's like it's not there. That's a measure of comfort. So you
what a
had the
beautiful
pain
metaphor.
condition. You had the pain condition, and then you did this beautiful thing to raise your mood up.
Right.
And other things.
Yeah.
And guess what happened? You felt better. Okay? Even though the pain was there, you felt better. So when your comfort level goes up. So what I do with folks who come in is, yes, I'll do a little assessment just to understand what they've gone through, okay? These losses that they've gone through that you mentioned.
Right.
I can't do what I used to do, can't play with my kids, and I'll come back to that. But, and explain how pain works, but then we don't deal with pain. What I'm trying to help the person do is raise your comfort level, because what happens is, the way the brain works is that, well, as an old rabbi said, wherever your attention is, that's where you are.
Yeah.
Wherever you're focusing, that's your experience, okay? You focus on that dessert, you're having it, okay? You focus on misery, you're gonna feel it.
Right.
And it's somewhat simplistic, but in the brain, more room is made wherever you are putting your attention.
Right.
So if we try to manage pain, or control pain, or accept pain, or do these kinds of things with pain, we're still focusing on pain.
Right. Right.
So what I do with someone is I say, listen, would you like to feel more comfortable? And most people say, yeah.
Yeah.
Okay. And so we start to focus on skills that can raise your comfort level up. So one thing you said is, oh, I can't do this, I can't do that. And it's true, it's terrible. What happens if you keep focusing on what you can't do? Your mood goes down,
I'm
meaning
depressed.
you get more miserable and
Right.
the pain goes up.
So then you ask me what I can do.
So then that's one thing.
Yeah.
But first, I just had this simple idea of, you had a body that can do more than it's doing now,
Yes.
comfortably. I
Yes.
call that the old body. That's your
Okay.
old body. Unfortunately, you went through this injury or whatever happened, and now you have a new body.
Yeah.
And this new body has this pain.
Right.
And so what I'm going to do is work with you to find out how you can get more comfortable around this new body. It is very possible. I mean, I've worked with 12, 15 years, actually more than that, but that was just at Kaiser, with people, and I see how they're stuck in this. It's hard to live in this new body that has this pain.
Yeah.
But you can play with your kids. You can do a lot of the stuff you used to do. You just have to do it differently. You can do it differently. I'll tell you a story. A woman would play, who I work with, she has terrible back and terrible knee pain, and she used to love to go with her girlfriends and play golf. I notice there's a lot of golf here in Hawaii, okay? And now she can't play golf. And when I met her, she was very depressed. She never hung out with her girlfriends because she felt, I can't golf, why can't I go? You know, because afterwards they go to lunch and she felt terrible. I said, try doing it differently. And so she said, okay. She comes back the next week and she's like shining, she's happy. I said, what's up? She said, I did it differently. Well, what'd you do? I could play maybe 2 holes carefully. And then I just rode in the golf cart. And we just talked our heads off. And we got to lunch, had a great time. And so that started shifting her life. She can get back into a normal life. You just have to do it differently. I mean, that is really the key.
That was very artful. I mean, you didn't tell her what to do. You just said, do it differently.
Although I am very directive, you know, I will come up with things, but that's the basic message is how can you do things differently that fits your body? You know, unfortunately, like people who want to work.
Yeah.
And the injury, you know, you can't sit that long, you can't stand that long, whatever the problem is. It's just really painful. So I'll say, you know, in this country, in many countries, it's one size fits all. You have to work 8 hours and you have to do this thing. Instead, you can work differently.
Yeah.
So it fits your body, because
Right.
in the usual situation, you have to fit the work situation. Your body can't do that.
Yeah.
So one skill is to figure out how to do it differently there, okay? And I've had a number of people start online businesses, for example. One guy was a carpenter, and then he became sort of an overseer, okay? He set up rebuilding houses, and this is the exercise he would do. Do that over there, now do that over there. His back was saved because he was just giving directions to the young guys who were doing the hard work that his body can't do. He felt great.
Yeah.
So there's a way to use your new body to actually do more comfortably.
One of the hurdles must be making that, coming to the point of acceptance that I don't have the old body anymore.
Yeah.
That's a tremendous loss.
It is hard, and unlike some therapists, I mean, I definitely will acknowledge the person's sadness over the loss.
Yeah.
But not for long. Because they have so much to give. And they may not see it at first because you've been to doctors. And doctors are fine, they're helpful, but most physicians are trained in acute pain, short-term, fixable pain. They don't know quite what to do with someone with chronic pain. Some docs are great at it. Definitely chronic pain docs know how to help them. And more education is happening for the docs. But they feel so down that that's the message they keep getting. I'm sorry, but you'll never be able to, you know, and that's the message they'll get over and over. And I also do hypnosis, and I realize if you keep getting the same negative message, you're going to feel negative. And so I look at what's going well. So I'll do a group, for example. And in these
Let
groups,
me just hold you right there, because
please.
she's whispering in my ear. I want to
Okay.
hear more about the hypnosis and the group when we come
Okay,
back.
absolutely,
Okay,
absolutely.
we'll be right back with part 2 of Shrink Wrap Hawaii. Don't touch that mouse.
Hi, I'm Jay Fidel. I'm host of Hawaii, the State of Clean Energy, which is our flagship show, which plays 4 to 5 p.m. every Wednesday. And the supporters of that show are Hawaii Energy Policy Forum and Hawaii Energy. And luckily enough, we have representatives of both of them right here today to tell you more about what they think about the show. Sharon Moriwaki at my left is co-chair of Hawaii Energy Policy Forum, and she goes first. Sharon?
Thank you. Thank you, Jay. I'm so glad that we have this Hawaii, the State of Clean Energy. This was 2 years ago when we started this, and we have continued it because it's so important, and there's so many developments happening across the state We hope you'll tune in every Wednesday, 4 to 5. It's wonderful.
And Ray is Hawaii Energy. Ray, what is your thought about the same subject?
Well, I agree completely with Sharon that we are talking about every Wednesday, 4 to 5. We talk about some of the most important subjects that are affecting the islands now and into the future. Energy, clean energy, we need it. We often run into new ideas that we had not thought about before. We did just today, and I think we're going to have more of that in the future. So come on down and watch us 4 to 5 on Wednesdays, and we'll see what happens.
We'll see you then. Aloha.
Aloha.
Welcome back to Shrink Wrap Hawaii. I'm Steve Katz, and I'm with Dr. Daniel Lev, and we were just about to talk about groups and hypnosis, yes?
Yes, terrific. Well, why don't we start with groups? So,
Yeah.
or I'll call it the workshop. It goes about 8 weeks. And we would sit together, and for part of it, I would train people in one of about 36 different skills that you can use. I call them comfort skills, so that they raise your comfort level up. Oh, am I okay? I'm
Are we
good.
okay?
Terrific.
I do.
Anyway,
I
so
think you got unplugged.
did we get unplugged? You got
I
unplugged.
got unplugged.
Okay.
All right. Stand by. Why don't you talk?
I'll talk. I'll talk.
Put the camera
So
on.
we would be in this group, and instead of doing what some therapists would do, which would say, "How do you feel?" "Not so good, I'll bet." No, we don't go there because that makes you miserable. Instead, I'll ask this question that comes from a certain orientation in therapy called solution-focused therapy, which is, what are you noticing has been going on lately
That works.
that you want to see happen more, large or small? And believe it or not, that little question, what do you want to see happen more, that is already happening?
Right.
It's already happening. So maybe and it could be really small, like I slept 2 minutes, I had 2 minutes more sleep on Wednesday, all right? It could be that small. However, the funny thing is you start noticing what's going well,
Right.
even a little bit,
Yeah.
you start noticing more. I call this a noticing skill, noticing positives. And as you start to use the skills, the other skills, you'll start noticing things are feeling better, okay? So we'll actually go around, and it's an inspirational meeting. I mean, people are inspiring each other, and then later on, some people say, "I went to a baseball game, I can't believe it. I hurt like hell, but it was great," you know? And they found a way to raise their comfort level, so even though the pain was there, it didn't stop them. That's the whole key, is when you raise your comfort level up, you're not allowing pain to control you. That's why this book I'm coming out with, I'm calling it You're Bigger Than the Pain. Because you are, even though you don't feel that way at first, when you start using these skills, you start becoming aware of how much power you have over this. But not through directly getting rid of pain, but raising your comfort level, and pain starts to shrink in its own way. In the brain too, that's how it works. So you asked me about hypnosis.
Yeah.
So in the groups that I've done, I'll start and end with what I call a refocusing skill. And a refocusing skill, it's called that, some people call those relaxation skills, but that's a side effect. What are you really doing? So let's say you're doing a little meditation, you're focusing on your breathing in your belly, and then you're going to get distracted. Oh my God, is this working? Or what time is it? Or I'm hungry. Those are all distracting thoughts.
Right.
And when you notice you're distracted, all you do is let it be there, don't fight it, and just bring yourself right back to focus. You refocus, okay? And it builds your ability to control your own attention. So pain isn't yanking it away all the time. You actually have some way to direct it. So hypnosis is probably one of the most powerful ways to do that. And so I will train people in how to use hypnosis to get more comfortable.
The refocusing thing, it reminds me, sometimes I have clients that I try to do meditation with, and they say, I can't do that, I can't do that. My mind's all over the place. And I try to explain to them that that's true for everybody. Your mind's all over the place. And they think because they get distracted that they can't meditate. I say, no. It's just like, your mind is a little puppy, and you just have to give it a little tug back. That's all. You know, don't get mad at it or anything. Just say, I'm aware that I'm not focusing on my breath, so focus on my breath.
So I love to share this. I got my doctoral dissertation, and I really focused on meditation as my focus. So I got to read all about meditation and research. And can you guess how long can a Buddhist monk who sits 6 to 8 hours a day, 10, 20 years, how long can they keep their attention focused before they get distracted?
A minute?
You're close. 30 seconds.
30 seconds.
30 seconds. Why? Because they have the same problem that you have. They have a brain. And that's what our brains do. They're jumping, they're remembering, they're this, they're that. And of course, when it comes to dealing with chronic pain, you're noticing pain, you're noticing pain, you're noticing.
Right.
It's doing all of this stuff. And when you can find a way to bring your attention right there, or wherever there is, it could be watching the waves, it could be watching your baby, it could be just listening to a piece of music, focusing your attention. And when you get distracted, just refocus right back. And then you get distracted. And the more you do it, the less you get distracted. It's so amazing. I work with people who have terrible anxiety problems, and they're thinking all the time. And they find, even with something as simple as meditation, they get distracted less.
Yeah.
And when you do that, your body goes into a calming mode. And remember I told you about your nervous system gets hypersensitized.
Right.
It calms the heck down. And when it calms down, most people feel better. And that's what the training is about. It's learning how to focus your mind. I'll tell you quickly, it's 6 strategies, okay, that have different skills in each one. So imagine a wagon wheel. And the center is noticing.
Okay.
Like I told you, noticing the positives,
Right.
but also notice the negatives. What's the first sign in your body when you're going to get a flare? And a flare is, people in chronic pain will have, let's say, about a 5 out of 10, 6 out of 10, where 10's the worst pain.
Yeah.
Usual pain level. It shoots up to 7 or 8 or 9, that's a flare.
Okay.
But often there'll be a little sign in your body or your situation that'll tell you, uh-oh, I'm heading for a flare. Noticing is in the middle of that wheel, because if you notice, then you can draw on the other skills so that you can you can stop that flare from being so bad. Another skill is the refocusing skill.
Wait. So you notice something in your body that's almost like when people are going to get a migraine, they get what do they call that?
An aura.
An aura or some other telltale sign that
exactly.
something's about to happen.
Or
so when you do
tension.
notice that, then what do you do?
Well, this is the thing. You notice it, and then you take action. All right? You don't blow it off and say, no, I'm going to keep doing my gardening.
So
you
what kind
sit
of
down.
action?
One is refocusing skills, like I said. Meditation, breathing, imagery, hypnosis, okay, those kinds of things. Or it depends on your need at the time. Maybe you need to use a moving skill. These are different ways to move through things in life. Like sleep. How do you sleep better? There's skills that can help you sleep. How you can move your body in ways where you don't get a flare-up. I call it the body bank. If you overspend your comfort time in there, you're going to get a flare-up. It's like going bankrupt. A third is how you manage a pain flare. You have a plan on how you deal with the flares. And the fourth I can't remember now because I'm on camera. So that you might use moving skills. You might use enjoying skills. Oh my God. You might sit and watch something funny. Because when you laugh, now don't be alarmed. That was fake, right? But right now my brain is sending endorphins into my system and I'm feeling good. Because our brains know the difference between real and fake laughter.
I had a very good friend whose mom was at Pohainani for older folks here. And they had a laugh therapist come in.
Oh, great.
Right? And she was trying to get her mom to go to the laughing group, right? And she refused to go. She said, I don't understand those people. What's so funny?
But you get yourself to laugh. Enjoying skills is also doing things you enjoy. Even if you're feeling bad. Take that bad with you, put it in a box next to you and watch the waves or whatever it is that you enjoy. Or perhaps you're bothered a lot by negative thoughts.
Yeah.
And thoughts, it's like this guy comes up to this woman, I got this amazing thing in my hand. If you see it, it'll make your life better. She says, yeah, great, come on. She follows him down the street, comes to a bunch of different people, tells them the same thing. They follow him all over. Finally, he says, you ready? Here it is. Nothing. And he runs away. He got them to go down one street, another street for nothing. That's what a thought is. It's nothing. A thought is absolutely nothing
But it can change your life.
unless you follow it. If you follow a depressing thought, you get depressed. So the rethinking skills are to help you catch negative thoughts before they take you into those
That
negative
reminds me,
moods.
I know people in the 12-step recovery thing, for drugs or alcohol, whatever. And one of the things in that program is the first thought is free. Meaning, I want to use.
Right.
That's free. It's what you do after the thought.
That's right, exactly.
Do you follow the thought?
Exactly. No, that's great. I have to remember that. That's great. And the last category is relating skills. Either how to develop more friends, because so many people in chronic pain are isolated.
Yeah.
And people, good people, are great at distracting you from pain. They raise your mood up,
Right.
which means it raises your comfort level up.
Right.
Or, my favorite, how to deal with annoying people.
Oh, tell me.
Annoying people are people you know and love, but around certain things they annoy the heck out of you.
Yeah.
And so there are a number of ways you can deal with them. One of them is to just avoid toxic talk.
Right.
Criticism, manipulation, those kinds of
Change the
things.
subject.
Right. Can't you just get up and go do something? What's the matter with you? Or other kinds of critical things.
Yeah.
And you can be very direct. 1, 2, 3. What do I want right now? When do I want it to happen? And what am I going to do if I don't get it? I need you to stop talking to me like that right now, or I am going to take a little time out. And then you turn around, you walk away. They'll do a little fly fishing. Oh yeah, go ahead, walk away. See what I care. No, what kind of wife or husband are you? Oh, and you just keep following your feet. This is really important. These will take you away from an annoying person because you cannot afford to listen to the toxic talking. It will hurt you. But you just don't walk away. You have to walk to something that's good. Because imagine someone throws up on you. Are you going to walk around with vomit all over you? No, you're going to take your clothes off. You're going to get dressed. You're going to take a shower. You're going to clean up. So when you walk away from someone who's hurt your feelings, that lowers your mood. That basically raises up your misery. So you want to lower your misery. You go do something you enjoy almost immediately. Go to a movie. Go to the beach. Go take a walk. Talk to a good friend. Whatever it is, that will raise your mood up again. But there are many techniques. I can't go over all of them now, but definitely very useful. I will say something about hypnosis, though.
Okay.
When it comes to chronic pain, hypnosis is helpful for weight loss and quit smoking and things like that. But it's even more helpful for people in pain. It's just shown over and over again. You know what a functional MRI is? So it's like a video of what's going on in your brain, so to speak. And they've hooked people up with a shocker on this arm, and actually they're holding a button with this arm, and this arm has a heat pad that's even better experiment. And they raise the heat up to a point the person says, ow, because they press the button to let the experimenter know. In the MRI, it shows certain parts of their brain are active. The pain, certain pain parts are active. Then the hypnotist comes in, hypnotizes them to make this arm numb, so nicely numb. Oh, it's so beautiful. And then they raise the heat up to the same temperature. They don't press the button because they're not hurting. The MRI shows those parts of the brain are quiet. So we have all kinds of evidence like that shows when you use hypnosis, you directly change the brain to reduce the pain, to increase your comfort level.
Hold it right there. We'll be right back with the final part of Shrink Wrap Hawaii. Bye-bye.
Aloha, namaskar, and hello. My name is Anu Hito. My show is called Climate Change Beyond Outrage. In it, we go beyond outrage to discuss solutions to global problems on climate change facing people, nations, and the world. Join me here every Tuesday at 1 o'clock on Think Tech Hawaii. Aloha and bye-bye.
Aloha, I'm Jim Sean, the host of Think Tech Hawaii's Education Movers, Shakers, and Reformers, interviews with people who have special insights into education from preschool through adult education. We are live streaming every Wednesday at noon, also posted on YouTube and the Hawaii Educational Policy Center. Please join us weekly for some of the amazing, innovative movers, shakers, and reformers in education in Hawaii. Aloha.
Aloha! How you doing? It's me, Angus McTech, asking you to come join us on Think Tech Hawaii Hibachi Talk. Join me and my two hosts, Gordo the Tech Czar and Ender the Security Guy, every Friday from 12:45 till 13:45. See you on Fridays, and remember, let your wing gang free wherever you be.
Welcome back to the final segment of today's Shrink Wrap Hawaii with Dr. Daniel Lev, who is, I just want to say, I wish I could take you with me in my pocket because it's a lot to remember.
You can.
I can't. No, so how do you just mentioned that you teach a class so that people can remember these things?
Yeah. What I'll do right now, I'm working mostly individually. I have a private practice in Kailua and a day up in Haleiwa. And the reason I left my job doing this in the mainland is because only in Kaiser and the VA do they have this regularly. They have chronic pain psychologists that can train people in these skills. And the rest of the world doesn't have it.
Yeah.
They can have insurance, but they're not that many chronic pain psychologists. So, and I love this place, so I thought, let me try doing it here, and it's happening. I just need to get enough people who have chronic pain who are interested in group. And that's coming. That's coming. I've got a good number right now. But when I do a group, it will be very much like this, that we will talk a little as a group. I'll do some training in some of the skills. We'll use some of the meditation or hypnosis practices and check in on how people are doing. So right now, though, until that group starts, I'm doing this individually with people. And then I'm tailoring the skills to the person's life. So some people, their relationships are great, no problem. You don't need the relationship skills, but you might need more of the enjoying skills because you're just not having enough fun and your mood's down a lot. Or it could be a number of things.
You would think that the insurance companies would set you up because I would think this would save them a fortune. Really, because rather than going to one doctor, one doctor, and it going on for the rest of their lives, if they could be taught how to deal with it on their own. I mean, because that's the goal, right?
Sure. Well, actually, I have outreach to the companies. And without naming names, there was one that was interested, and I was wanting to create a kind of like an intensive program where we would meet for 4 hours once or twice a week for 4 weeks. But that hasn't come through yet. And so until then, I'm working with various other practitioners to try to put together a team in that way. Or I work with people's doctors, whoever your doctor is, I will work with that person. But mostly, you know, when you're in private practice, you're working with me individually and with your particular situation. And so I do kind of like the class with you individually. And then probably, hopefully within the next 3 to 6 months, hopefully less, I will have enough folks that I will start setting up a group. Like in Haleiwa, I'm going to start a relationship with a physical therapist because the model is I'll do what I do, and then the physical therapist will do a little bit of a movement class. And how you know, especially people with neck and back problems, how do you move and not hurt yourself? And if you can move in ways that reduce, not that you're damaging yourself, but you're making the pain worse, how can you work in those ways, still get some things done, and at the end of the day, you don't have a big flare. And so that's what they do in their component, is they can help people that way.
Before I forget, I mean, this is very exciting, what you're talking about. Is there a website people can go to see your stuff? Or?
Absolutely.
What's the website?
Kailua Comfort Clinic.
That's pretty easy.
.com. Kailua Comfort Clinic. I'm the Comfort Doc at Gmail if you need to write me. And but you can just Google Dr. Daniel Lev Kailua or Hawaii, and I'm the only one here with that name. So definitely, yeah. People get a hold of me if they need to.
It's really what you're doing. I know they're doing it other places, but part of what you're saying is you're just really good at the presentational part, which is a very important part. Because like before I was telling you, I went to somebody to get hypnotized and it didn't work, and I thought it was my fault, but like you said, if you need a plumber and one plumber can't do it, you go to a different plumber.
Yeah,
right?
you find the right person. All therapists aren't the same. And
Yeah.
here's the weird thing. Therapists are people.
Most
I
of
mean,
them.
really, doctors are too, you know, and
Yeah.
they have, you know, everybody's different. And if you don't have a good relationship, that's okay. You say sayonara, and
Yeah.
you go find somebody you can.
Yeah,
You know?
especially with therapists, more so than, say, somebody who fixes your broken arm. It's not as much about the relationship there as it is
Yeah,
with a
you're right.
therapist,
You're right. In other words, you talk more with a therapist than you
Hopefully.
will a
Right,
physician. But
right.
yeah, absolutely. So
Yeah.
it's really important. And that's why when I'm working with someone with hypnosis, and I work with people that give me that same message.
Yeah.
Oh, I've been trying to be hypnotized, it doesn't work. And it's about the relationship. How can I work with you to discover with you how you can use your innate ability to get comfortable using your mind in that way?
So when you say get comfortable, hypnosis is just like a deep comfort? Is that what it is?
Well, this is a side effect, okay? You will go into a state, a very deep, comfortable
Jersey?
state. Maybe Jersey, maybe Florida, okay? Hopefully Hawaii.
Yeah.
But you know what I'm saying? You will go into a place, and this is what people say. It's not, I'm not making it up. People will say, they'll come out and say, wow, I felt like I was somewhere else, you know? Or some people will say, you know, I felt like I was just sitting in a chair listening to you, but I feel real good here. So there's all kinds of ways to go into that state. There's no, you know, people are different.
Yeah.
You know, and so I work with the person to find out from where they are, how can I work with you? If it's at all possible. And maybe hypnosis isn't for a certain person, and that's fine. But I found most of the people I've worked with
Yeah.
have found a way to use it and other skills to get more comfortable.
So the tools that you give people, does it depend more on the kind of pain or the kind of person, or how do you decide what works?
More the person's situation, you know, and the person, but maybe a little bit the kind of pain. So if I'm going to do some kind of relaxation technique or refocusing technique, I'm not going to ask them necessarily to stay in their body if they have headaches. Because often headaches are so intense,
Yeah.
even if you're focusing on your breathing, it could be too hard. On the other hand, sometimes what works is to focus on your toes. Imagine you're breathing in and out of your toes. But more likely, I would ask them to imagine they're going on a head trip. Go anywhere you want in your mind. Do whatever you want there, alone or with guests. And you can have any kind of body you want. It's like having a dream on purpose. And you kind of go on that little head trip if you need a break from your body.
You mean like if you're having a headache?
If you're having any kind of pain.
Yeah.
It could be any kind of pain. I mentioned headache because with headache, you definitely a lot of people need to get out of their body for a while if they're having a bad one. If they're just starting to have a headache, then you might be able to do other things. But
So if they're having a bad headache, then you would take them on this imaginary
yeah, we
trip.
might do that or something else.
Yeah.
But for the most part, pain is pain. It travels through the nervous system, even if it's in your head. It has to go through your nervous system to get into your brain, to be processed by 6 or 7 different structures in your brain that process pain. And if you are dealing with chronic pain, I highly recommend you learn a little bit about it, especially how the brain works in this, because it'll just give you more understanding. You're not crazy. You're just dealing with a condition that, by the way, is the nervous system. Because that it gets sensitized, often it will generate pain that's not even happening out there, or pain that's not, you feel worse than you should, you know, for the amount of stimulation you're getting. It's because the brain's overstimulated, and so a lot of these skills are to calm it down. The medication will kind of force you to numb it out.
Yeah.
But here's a really cool thing. If you want to get a good car, and you're not quite sure about how you find a car, maybe I'll hire you. You know about cars, and you go and you find me a car. And it might take you a long time, and you come back and you find something, and it's just not what I'm looking for, and I have to pay you. All right? So it takes a long time, okay? It's not what I want, and it costs me stuff. That's medicine. Now, I'm not saying medicine is bad, but medicine, you take the pill, it has to take a long time to go through your digestive system, your cells, till you get to the nerves, and then it might work. And it won't work perfectly. And it costs you
And you might get addicted to it.
Right, it costs you side effects.
Yeah.
But your mind and your brain are connected. So when I focus my attention, which is my mind, on my breathing, let's say, or something that can calm my body down, it happens real fast. So 8 minutes, I was working with one woman, 8 minutes, she had the same result as an injection of morphine.
Wow.
And it takes about the same time, okay? It's amazing. So when you're using at least hypnosis, it works faster and it's more profound and it's no bad side effects.
That was a very interesting definition you kind of tossed out there. Your mind is your attention. Because people talk about mind, and I'm never really sure what they mean by mind as differentiated from brain. Yeah.
It's one aspect, you know. I mean, people can get very complex. I mean, you talk to a cognitive psychologist, and they'll tell you there's a lot more than just attention. That is a component. But for what I'm doing with people in chronic pain, that is the component. That if you can get a handle on your attention, no matter how difficult it is, every time you get pulled away, to bring it back to something neutral or positive, looking into my face, you know, whatever it is, okay, that you will start to build your concentration muscle so the pain won't yank it away all the time.
Now, I would assume that if somebody is coming to you for a pain, that they've been to a regular medical doctor first to rule out. I mean, maybe they've got a tumor, and you're teaching them to ignore the pain, where actually the pain is telling them, hey, we got a tumor.
No. What I do, and I'm glad you brought this up.
Yeah.
You need to make sure you're medically cleared, that the pain you're dealing with is not something they could fix.
With surgery or something
with
like
surgery or medication. It is
Yeah.
chronic pain, meaning it's a condition that may not, for the most part, is not curable, but you can learn to not live with it. Oh, this is important. I don't want to help people learn how to live with pain. That is not my goal. My goal is to help you learn how to live life. It's not about living with pain. Life's much bigger than pain. It's part of it.
Yeah.
But so if you have chronic pain, it's something that physicians can't fix, then I work with you. I make sure that that's cleared before doing that so that you can live life.
So in other words, part of that focus thing, putting your focus somewhere else besides the pain.
Well, okay, you mentioned a really good thing. Well, what if it's a tumor? Well, that's acute pain. That's
Yeah.
giving you useful information. Oh my God, I gotta pay attention. I got a pain down here. Maybe it's my appendix. I'll go see my physician. And if it is, okay, good, that was very useful pain. But if I happen to have a digestive pain, okay, or ulcers, colitis, all kinds of things that are not, they can't really treat very well medically, then you can use someone with my skills to help you get more comfortable around it.
Well, which I would think would also reduce the physical stuff going on because you're lowering the stress.
It does, actually.
Yeah.
So physically, you know, this is what mind-body medicine's about. You use your mind to change things in your body. And it takes some time. But as you do, well, I've seen this over and over again. Most of the people I work with sleep better, they feel comfortable, they do more things. It doesn't mean all the pain's gone,
Right.
but they don't let the pain interfere with their life in the same way,
Yeah.
you know? So that's essentially what I do.
I mean, and it sounds like eventually we all need what you're selling here because it's part of getting old. You get up with aches and pains, and some people focus on that, and some people focus on dancing. Yeah.
And I use these things, and I didn't make all these things up. I'm just framing them in a different way, that they're not to help. I don't use them to help you manage pain. You know, get an MBA, you can manage pain, you know, because it focuses on the pain. I'd like to rather use these skills to help you get more comfortable around the pain so that after a while the comfort is so strong the pain is not as annoying as much.
Well, I think we're about to come to the end of our show, and I just really wanted to thank you so much. You taught me so much, and I hope everybody who has chronic pain gives you a call.
Sure. Thanks a bunch. And thank you, everybody.
This is Steve Katz. I've been talking with Dr. Daniel Lev, and I wanted to thank everybody for tuning in again to Shrink Wrap Hawaii. See you next Tuesday at 3 o'clock or whenever you want. Bye.